This episode of the Folding Towels podcast is brought to you by Hygiene Australia. Did you know that oil retention in towels isn't just gross but can be a fire hazard? Hygiene Australia have worked with the health and wellness industry to develop cleaners and laundry products that are guaranteed to remove oil residues from your towels so that they feel and smell clean, last longer and reduce your risk of laundry fires. Listeners can get 15% off their next order when they visit hygieneaustralia.com.au and use the code 15OFF-FOLDING-TOWELS. Welcome back to another exciting episode of the Folding Towels podcast. How are you doing, Jackie?
Hi, David. I'm really good today, thank you.
We are just going to jump straight into this episode. No banter, but we've got another controversial episode for you.
We love the controversy.
They're controversial, but people are asking these questions, so we're coming at you with the answers that you've been asking for.
So today's episode, we are reflecting on these words. Oh, you should probably get a note from their doctor. Does my client need a note from their doctor about their health condition, David?
Oh, look, it's been a mantra of our industry for some time. The risk averse, who rather than doing a bit of research and taking a bit of confidence and understanding what they do for a living, try to palm off responsibility onto another health practitioner. Now, do you remember going through massage college and having to do that subject called pathophysiology?
Vaguely. I think I've blocked some of that. It was a touch traumatic.
Yeah, it was long. And I remember having to research 200 common conditions, thinking, who is going to present with these things? And it was everything from someone presents with tinea to they've got a tumour, they've got Cushing's syndrome to chronic fatigue syndrome, and everything in between.
There are so many thousands of illnesses and conditions out there, and we absolutely cannot know what they all are. Do you know, I actually do consider sometimes going to medical school for a year or two, David, just to learn about this stuff, because I do find it very fascinating.
It is fascinating, but jeepers, the human body is complex and just so much can vary from person to person, and some really weird things can happen to us.
Yeah, the human body is weird.
It is weird.
It's my official stance on this.
Do you remember episode 30?
Oh, is that the one asking good questions? Yes, taking a good history, yeah?
Yeah, that's the one, taking history.
Yeah.
Yeah, and asking questions about relevant medical history.
That was a really good episode, actually, and very important, I think, for our field, because we do straddle that line of complementary therapy and allied health, and we are technically not allied health here in Australia at all, but we do assist people with some complex health conditions.
Yeah, and all sorts of things crop up when you look at those intake forms, whether it just be someone has come in and they've got diabetes, and you knowing and having the confidence to ask, do you have a management plan? What if you have a low while you're on my table? Something along those lines. Someone's got asthma and you know not to use particular scents or fragrances in your clinic. All sorts of things that we do need to know about just as part of standard treatment. But then there's the weird ones that come in. Now, I'm going to just come out and say, because we're about to talk about pregnancy for a moment. And pregnancy is not a disease. It's not a condition. But it is one of those which does crop up all the time about getting a doctor's note. What do you want to talk about with this one, Jackie?
Yeah, David and I already discussed some things before we started recording with this one. Pregnancy is absolutely not an illness. It's not it's not something that we need to be, oh my God, I just can't. But things can crop up with pregnancy very quickly. The body changes so much when you are pregnant, and some health conditions can be exacerbated by pregnancy, and some health conditions can actually go into remission through pregnancy.
Now, you might be listening to this saying, oh, I don't work with people who are pregnant, but chances are one of your clients might actually get pregnant. And then are you going to refer them to someone else, or are you going to try and provide a standard of care to them?
This is where, and I think we're in agreement here, David, that we really need, as therapists, we really need to perhaps niche into a specific subset of the population, whether that means that we do see people that are pregnant or we don't see people that are pregnant. You might have done a little bit of training, and I actually know a couple of people who have just finished their qualifications recently that have told me they absolutely got no pregnancy experience, no class on pregnancy through their diploma at all.
Yeah, my diploma did not cover pregnancy at all. It was just refer.
Wow. Okay. Interesting.
But then they handed out at my college, and hello, Catherine McInerney, that's how I met you, was through my college. Catherine is the director of Pregnancy Massage Australia, and she provides very specific training to assist massage therapists to be confident in providing a good and very diligent standard of care throughout a pregnancy.
PMA is definitely the place to get your pregnancy massage training from in Australia. There are some wonderful providers that I know of in the UK, and I'm sure there's some amazing ones in the US and elsewhere around the world. But basically it comes down to, if you don't have the confidence to treat a particular person with a particular health condition, you should be referring them on to someone who is qualified. And so if that means that you don't want to see pregnant people, whether they're in a first trimester or third trimester or postpartum, then it means you need to find somebody in your local network who specializes in pregnancy and is happy to take on those clients for you. And every time you get a client that says, oh, hey, look, I'm actually 12 or 13 weeks pregnant, you go, oh my God, like this will be the last time I see you for, the next 9 months perhaps, because I'm going to refer you to this wonderful colleague that I have that's going to look after you. And then you can come back and see me after, you've gone through the postpartum period.
I have undertaken a basic level of training through Pregnancy Massage Australia because I love the conversation when a client comes in and they're looking a little bit hesitant and it's like, I know what you're about to say. And they're like, I'm 10 weeks pregnant. Can I still be here? It's like, yes, you can. And I can care for you right throughout your pregnancy, unless something weird happens and there is a specific condition that crops up where you need a higher standard of care. Then, you know what, I've got some friends who are highly trained in pregnancy massage. You can see them right now if you want to, but you can see me unless one of those things comes up. And I've also got some women's health physios who you absolutely should be booking in to see as well. Congratulations, it's so exciting.
That is a fun conversation, yes.
Yep.
Yeah. And the reason that we are talking about pregnancy so much is because this is something that is very repetitive in the Facebook groups. We see this conversation all the time. And one of the standard answers, as we mentioned, is, get your doctor to say it's okay for massage. But to be honest, GPs don't know. They just don't know. They don't understand what massage is half the time.
No, they are not specialists in or muscles or ligaments or conditions thereof. There are other fields which have far greater knowledge, but a GP is a referral service often to people who do have that knowledge.
GPs refer out all the time.
Well, that is now what they do.
Yeah.
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 Look, I guess why we're making this episode is that some massage therapists are really risk averse. So instead of asking good questions and doing good research, they're more inclined to say, no, I need a note from your doctor. in the hope that this is going to absolve them from risk. And the reality is that even with a note from a doctor, if harm comes to your client because of your care, you are not without blame. So there are loads of medical conditions out there. Many of them have got long names, and most of them we probably haven't heard of. But especially now with access to the internet, it doesn't take long to look something up and to make a judgment call about whether to treat that person or not treat them.
Yes. And we absolutely need to be asking good questions of our clients, because you know what? Our client lives in that body 24/7. They know about their health conditions for the most part. And they can often tell us so much about what's been happening for them, particularly if they have something complicated and chronic. And Dr. Google is really easy to use. I know that's such a controversial topic. I'm sorry, David. But it is super easy to look things up now and go, oh, right, okay, I understand what that particular disease is. I know the basics now, and then I can make a more informed decision whether or not to see this person.
I have this feel that if you're sending someone out for a note from the doctor, you've got an underlying knowledge that perhaps you shouldn't be treating that person, and in the hope that someone else will say it's okay. And let's just say, and this is a real case for me. Someone came in and said, "I've got some calf pain. Can you help me?" And so I asked some questions. Oh, look, you just got off a long haul flight.
Oh no.
Oh, look, your calf is red and hot to the touch. I can't touch you. I'm not sending them for a note to their doctor. I'm sending them to the hospital because their life is in danger.
Oh dear. Did you get an outcome for that, or did you just not see them again, David?
I never saw that person ever again. I don't know whether they died or whether they were too embarrassed to come back.
This is where it gets so tricky. Like, you absolutely did the right thing there. But
can you imagine saying, "Oh, I'm not going to treat you unless you've got a note for your doctor," and the doctor's like, "Oh," let's just say you get someone having a bad day or somebody who's a bit lazy. Because in any field of any profession, there's just some people who shouldn't be there. And they say, "Oh, I'll just write you a note. Yes, so-and-so saw me with a sore leg. I think they've pulled their calf." And you treat that person anyway, knowing that you think something is of risk, and they do have a thrombosis, and you kill that person, you are still to blame.
I'm terrified right now. I think you're right, though, David. I think that deep down, a lot of us work from a place of intuition, and sometimes we just know we shouldn't be seeing a particular client. I had somebody this year who didn't have a medical condition. I think they actually had a mental health problem, and I felt very uncomfortable having them in my clinic, but I did not feel comfortable sending them away. So they'd booked online, and everything seemed okay up until the moment they stepped into the room, stepped into my studio. And immediately I was like, there's something going on here. And I completely disencouraged that person to not book again with me because I knew there was something wrong. But I did not know how to address that. It's totally okay to not want particular health conditions to show up in your clinic.
You can't be an expert on everything, and some people are experts in very specific things, and that's where having a great network is important. Someone who may have extra training in massage to support mental health, maybe it's end of life, maybe it's around oncology massage. There are specific trainings for whole bunches of things, even getting as very specific as particular foot pathologies for a runner, for example. There are people who've just done extra studies in those areas, and you should know who they are in your area for the best outcome for your client. But what we're really talking about here is knowing your scope of practice. And scope of practice doesn't include things that you've just learnt off YouTube. You can look up all sorts of videos where people get their heads jerked off the tables.
Oh my goodness.
You can't adopt that into your practice.
I think I'm having a heart attack right now just hearing that.
Yeah. Sure, you can learn information off the internet, but you need to be very careful about what you have trained in formally as to what you can adopt and safely adopt into your practice, into your scope. And this is also why we carry insurances, because there will be cases where something happens in your clinic. And if you have asked good questions, you have acted within your capabilities, you have acted within your scope, you have not done anything wrong. And your insurance will be there to protect you in that instance. It won't stop you from feeling guilty. You're a good human if you feel guilty about these things. But if you haven't trained in dry needling, for example, and you decide to stick needles in a person and you cause an injury, or you follow some radical person off the internet and you wrap a strap around their head and pull them across the table without the intricate training that comes with that, and you cause an injury, this is no longer a matter of insurance. We're talking about criminal charges here because that's negligence.
I just want to add, David, with some of those points, if you have asked the good questions of your clients and talk to them about their condition, you also need to make a note of it. You need to write down everything that they say.
Record keeping.
Yeah, this is so important because if you have somebody that comes in with a complex health history, chronic conditions, maybe they've had a pregnancy loss before, anything at all, and you haven't written it down in your progress notes that you've had that conversation, your insurance is going to leave you out to dry because they don't know what you did.
Let's get a little bit brighter from that.
I'm having a breakdown over here over this conversation, David.
People do come in with weird and wacky things to see us. And sometimes it's a bit of a test from that person to us where they might write down something on the form, or as you take their history, they mention something. And I'm quite comfortable these days in just saying, oh, I've not heard about that. Can you tell me a bit more? And usually there's almost a look of relief in their eyes. Some people look at it as if you're stupid. It's like, we're not talking about the common cold here. This isn't a bit of athlete's foot, which we all come across. No, this is new. I haven't heard of it. In order for me to treat you safely, can you please update me on your condition?
It depends what it is. And you're so right about scope of practice. Like we just have to really ask the questions and talk to the person. And it depends on what we're going to do. If somebody comes in for chronic headaches but wants some reflexology, that's probably okay. There's no contraindication there.
And again, real life case, a person booked in to see me at last minute on a particular day. Why are you here today? I've just been in a car accident. This is a case where I'm going to ask, not for a note for the doctor, have you been to the hospital? Has someone assessed you? I'll see you in a couple of weeks. And you need to have the confidence to turn a person away. But often someone will present, and you need to know the difference between a local contraindication and a total contraindication. Again, someone might come in with a sports injury. They've played footy and they've twisted their ankle. No massage for 48 hours on that ankle. But you can still provide treatment to other areas of their body quite safely.
Yeah, I think a lot of people don't quite understand the difference between what is a local contraindication and what is a complete and total contraindication. And you might absolutely be able to do some work with that client. You can have them sitting up or completely avoid the area. So if it's a leg or an ankle or a foot, that's really easy to do.
Even a rash. You just work around those spaces.
Sunburn. Yeah.
Someone popped up in one of the forums the other day about working with someone with a staph infection.
Oh dear.
And thank goodness they asked the question. No one said get a doctor's note for it. They were just, don't treat the staph infection.
That one is a serious one.
Yeah. FYI, they could die. And it's not funny. But let's talk about insurance just for a little bit. We've already mentioned insurance briefly, but some insurance companies, they have dictated their terms of treatment. And there's one insurer here, as we circle back to pregnancy, one insurer here in Australia says no massage before 12 weeks of pregnancy, whether you have undertaken additional training in massage or not, in pregnancy massage or not. They just say, no massage before 12 weeks of pregnancy. And that is out of your hands if you're with that insurer. So whether it's a low-risk pregnancy or a high-risk pregnancy, whether they have a doctor's note or not, they just say no to the first trimester.
This is something that you absolutely need to research on when you are either changing insurance companies or getting insurance for the first time. You need to find out what is covered. If you do cupping, does your insurance cover cupping? And dry needling in particular is a really important one to check because you have to follow so many different guidelines around that.
And even if they do cover you, have you undertaken specific training in that modality? Mm-hmm. More than just YouTube.
Way more than just YouTube.
Yeah.
I want to bring up what is on our website and marketing materials, David, because I know we've used the example of pregnancy clients a lot here, but that's just like a really obvious, easy one to come back to. If you keep getting clients that are coming in to see you because of what's on your website, or perhaps it's a referral, but you actually don't want to see pregnant clients, then you need to make a change. You need to either change what is written on your website, let your clients know, hey, look, I'm actually not seeing pregnant clients anymore. Like, I'm going to refer them on. I've got this wonderful colleague that you can go and see and get the word out, rather than saying, oh, I need that note from the doctor, because that doesn't really help anyone in this situation. If you don't want to see a particular subset of people, make that change. Change your website wording. Let your clients know, hey, I'm not going to see pregnant clients anymore. I'm going to specialize in lymphatic drainage only.
The reality is we can't treat every single person out there, and nor should we have to. And let's come back to episode 7. All way back when. We were so fresh and new there, Jackie. We were so young. Well, we talked about building your referral network and networking for introverts. Having people that you can send your clients onto is a mark of your confidence and your professionalism as a practitioner. You can send them to the best people for the best quality care in their best interests.
We need to keep ourselves educated, David. We need to keep learning, keep reading, keep listening, and keep asking the questions in groups. And I hope that people don't think that we are picking on anyone by mentioning the questions in the Facebook groups about pregnancy and about all these other things. We absolutely want you to ask the question, because this is how we learn and how we grow and how we expand our knowledge. So please don't think that we are trying to make you feel bad. Absolutely not. We need these questions asked.
For the respondents to those questions, rather than telling someone they need a note for their doctor or going on the attack about, if you're not confident, you shouldn't treat. Well, this is true. If you don't have confidence about something, pass that person on to someone who does have the confidence. But also be really helpful and kind in your response to that person, because they are trying to grow as a practitioner. And we're all young once. And I don't know everything about everything. Don't know about you, Jackie.
Absolutely. I actually look at some of the new baby therapists and think, oh, how wonderful to be in that position, to have your whole massage career ahead of you and to be able to do whatever you want. You're starting out. It's brand new. Yeah. It's great.
I want to mention Ruth Werner. Do you know Ruth?
Not personally.
Yeah. So when I was being traumatized in my pathophysiology class all those years ago, Ruth is the author of the textbook that we referenced.
She is a legend.
She is a legend in our industry.
Yes.
I think she's got a medical background.
I think so. Yes.
Yeah, but she has a podcast with ABMP, and it's called I Have a Client With. Go and put that in your notes to look up, because she goes in depth into all sorts of medical conditions.
I literally, while you were talking about that, David, I literally went on her website, and the first thing that came up is a thing. It says, a doctor's note is not good enough, and what is better? And then it has a paragraph about a course that she actually runs. So yeah, if this is really interesting to you, 100% check out Ruth Werner's website.
We'll put a link in the show notes.
Yeah, she is a legend. She is amazing.
Yep.
Yeah.
Really easy to listen to. Some professionals and experts can be very tricky, and at the end of an hour you still don't quite know what you've listened to. Ruth is the opposite to that. She is super knowledgeable and super duper gifted at explaining things really well.
Honestly, there's so much training out there about this sort of thing. We'll try and add a few things to the show notes, but we definitely will be covering more topics about what associations offer and different webinars and things like that.
Yeah. Our associations really are the first port of call because COVID gifted us the webinar and the ability to learn online. It's become very, very common. And they do often have very specific courses from experts, not John down the road with a degree in life. They do bring in experts to talk about very specific things, and there's often an extensive bank of resources already online that are valid and that are vetted by our associations on very singular issues. And a lot of that training is free too.
Absolutely. There is a lot of stuff that is free or very, very cheap available from the association, which is great.
I want you to feel a great deal of confidence in your own ability, because things do come into our clinics all the time, and if you have the confidence to ask questions, chances are you won't do harm. And you probably already know more than you realize as well.
That is very true. And I think sometimes we just need to jump right in and start rather than overthink. I know that I'm an overthinker about some things, and I'm pretty sure you told me off even last week about overthinking, David.
Yeah.
We need to just get down to it and just do it and just have that confidence.
There are times when getting a note from a primary care provider is a really good idea, particularly if that client has been referred to you by that primary care provider. And that's where a doctor's note or physio's note or whatever, it's not about clearance, but spelling out, how can I support your treatment, or how can I support your client with their journey?
Yeah, absolutely. I honestly think the biggest takeaway from today's episode should be that most of us really need a strong referral network. We're not an expert on a lot of this stuff, and we need to pass on or help our clients find the practitioner or the therapist that is going to be able to provide the best care for that client.
Yeah.
If we have a good referral network, we might already know 20 or 30 other therapists, and you just haven't realized, oh, hey, they specialize in this, they specialize in that. Yeah.
Yeah, let's get out of our little boxes. And we've already said it in a few episodes, not competition, but colleagues.
Absolutely. I think we did talk one day, David, about how many therapists there were in the country versus how many people actually live in specifically Australia. And even if we all saw our maximum capacity of clients, we still would not be able to treat every single person in this country. So there's plenty of work out there.
I think we've talked enough about this, Jackie.
We have.
Yeah, let's move on.
We have. Let's not ask our clients for a note from our doctor. We don't need a medical certificate.
No. If you have suspicions about a person and you're not confident, you need to say no.
Yep. And you can always refer your client back to their GP. Hey, I want you to go and get more information about this topic.
We need more information.
Yes.
All right. If you love what we are doing here on the Folding Towels podcast, why not hit like or subscribe so that you never miss an episode? And if you're listening on Spotify or on Apple Podcasts, why not leave us a rating or a review? It helps us to be found by others.
Thank you so much for listening, everyone. We have loved chatting with you again, as usual, and can't wait to see you again next time.
See you next week, Jackie.
Bye, David. Take care.